Thank you for the opportunity to present our work. My name is Jordan Jackson, and I am a surgical resident from UCSF East Bay. We have nothing to disclose. Psychological Simple Triage and Rapid Treatment, or Psystart, is an evidence-based mental health triage system that was originally developed to facilitate the rapid identification of high-risk adults and children in disaster medicine. Psystart identifies objective risk factors such as extreme or ongoing stressors and traumatic loss. The evaluation of objective risk factors with either a yes or a no rather than symptomatology is why it can be used as a screening tool at the time of traumatic presentation rather than waiting for PTSD symptoms to occur. Psystart was studied in 371 children who experienced the trauma of being involved in the world's deadliest tsunami in Thailand in 2004. This study showed that having a delayed evacuation, having felt one's own or a family member's life to have been in danger, and having felt extreme panic or fear were significantly associated with the development of PTSD symptoms. In this study, we aim to use a modified version of Psystart for use in pediatric trauma patients. We also aim to integrate Psystart into the electronic medical record workflow and determine the feasibility of doing so. Once integrated, Psystart could be completed by a member of the trauma team and not require a trained mental health provider. We hypothesized that Psystart could identify risk factors for PTSD in pediatric trauma patients and could be integrated into the EMR. Activated trauma patients aged 10 to 17 at a level 2 trauma center from 2014 to 2015 were screened. If eligible, initially participants were given Psystart by a trained research associate, and the presence of risk factors and their frequency were analyzed. Psystart was then integrated into an automated EMR workflow, which would trigger an automatic consult to the trauma service psychologist if greater than one risk factor was present. After EMR integration, successful Psystart completion rates were evaluated to determine the feasibility. Of the initial 63 patients, 75% had at least one positive risk factor and 19% had 3 or more risk factors present. This is the list of risk factors evaluated. The 2 positive risk factors identified most frequently were felt or expressed extreme fear or panic in 43% of patients and felt direct threat to life of self and/or a family member in 32%. In conclusion, Psystart was able to identify risk factors in pediatric trauma patients. Regarding the feasibility, Psystart was successfully completed via the automated triage pathway in the EMR in 79% of patients. This study is limited in that it was performed at a single center and as a pilot study, therefore with a small cohort of patients. Additionally, we did not follow these patients longer term to determine if any patients developed PTSD symptoms. These limitations lend nicely to our proposed next step, which include an NIH-funded study to further evaluate the correlation of Psystart risk factor positivity with a PTSD diagnosis in this population, and also to determine a potential cutoff number for which to use to trigger formal psychological evaluation and treatment. Thank you.